Have you ever noticed yourself waking up several times a night just to use the bathroom? Or maybe during the day you feel like you constantly need to find the nearest restroom. At first it may feel like just a small annoyance, but when it keeps happening, it begins to affect your sleep, your energy, and even your confidence. For many people, the next step is obvious. Visit a urologist. But that's where the questions begin. What actually happens at a urologist appointment? Will it be embarrassing? Will it be painful? And most importantly, will they really be able to help? In today's video, we're going to take away that fear and uncertainty. Step by step, I'll show you exactly what to expect when you see a urologist for frequent urination, so you'll feel informed, confident, and ready to take control of your health. The first step of a urologist appointment is not a test or a scan, it's a conversation. Your urologist will begin by asking detailed questions to understand the full story behind your symptoms. They want to know when the frequent urination started, how often it happens during the day, and how many times you typically wake at night. They'll also ask if you feel urgency, pain, or a sensation of incomplete emptying after you go. Beyond the symptoms, lifestyle questions are just as important. The doctor may ask about how much fluid you drink, whether you consume a lot of coffee, tea, or alcohol, and even your sleep patterns. All of these habits can influence bladder health. Medications also matter. Some blood pressure pills, especially diuretics, can increase urination. Sharing your current prescriptions helps the urologist rule out side effects. Family history is another area they'll cover. Conditions like diabetes, prostate disease, or kidney problems often run in families and can provide valuable clues. At this stage, honesty is critical. Some people feel embarrassed, but remember, urologists talk about bladder and urinary issues every single day. The more open you are, the easier it will be for them to understand the pattern and identify potential causes. Think of this first conversation as building the foundation. It may feel like just talking, but it guides every test and exam that comes afterward. Without it, important details could be missed. After the initial conversation, the next step at a urologist appointment is usually a physical examination. This part may sound intimidating, but it is straightforward and provides essential information. The urologist may begin by checking your abdomen, gently pressing to feel whether the bladder is overly full or if there is tenderness around the kidneys. They will often take your blood pressure and record your weight, since both can play a role in urinary health. For men, a prostate exam might be recommended. This involves a quick digital rectal exam, which allows the doctor to assess the size and shape of the prostate gland. While it may feel a little uncomfortable, the test is brief and can reveal important signs of enlargement, infection, or even prostate cancer risk. For women, the doctor may examine the pelvic area to check for issues like bladder prolapse that can cause urinary frequency. The physical exam also includes general observations, such as looking for swelling in the ankles or legs, which can be linked to fluid retention and nighttime urination. Sometimes the doctor may check for neurological signs, since nerve problems can affect bladder control. Though this part of the appointment is hands-on, it's not about embarrassment. It's about gathering the clues that simple conversation cannot provide. Combined with your medical history, these physical findings help the urologist decide which lab tests or imaging studies are truly necessary. By the end of this step, you'll already have a clearer idea of whether the frequent urination is linked to common conditions, like an enlarged prostate or overactive bladder, or whether further investigation is required. Once the history and physical exam are complete, the urologist will usually recommend lab tests and, if necessary, imaging studies. These sums help to confirm suspicions and rule out hidden causes of frequent urination. The most common test is a urinalysis. You'll provide a urine sample, which is then checked for signs of infection, blood, protein, or sugar. This simple test can uncover urinary tract infections, diabetes, or kidney issues. If infection is suspected, a urine culture may also be done to identify the exact bacteria and guide antibiotic treatment. Next, blood tests are often ordered. These measure blood sugar, kidney function, cholesterol, and sometimes hormone levels like testosterone or thyroid function. Abnormal results can explain why your bladder is working overtime, or point to systemic issues such as diabetes or metabolic syndrome. If more information is needed, the urologist may turn to imaging studies. An ultrasound of the bladder and kidneys can show whether your bladder is fully emptying or if stones are present. A test called uroflowmetry measures how fast and how much urine you pass, which helps detect blockages. For men with suspected prostate problems, ultrasound or PSSA blood testing may be included. In some cases, a cystoscopy may be recommended. This involves inserting a thin camera into the bladder to look directly at the lining. While it may sound intimidating, it provides valuable detail if cancer, structural issues, or chronic inflammation are suspected. All of these tests are designed to build a complete picture. Instead of guessing, the urologist uses solid evidence to identify the real cause of your frequent urination, and that leads directly into the discussion of treatment options. After gathering the results from your history, physical exam, and tests, the urologist will move to the most important part of the appointment, the diagnosis and treatment plan. This is where all the information comes together to explain why you are experiencing frequent urination, and more importantly, what can be done about it. The urologist will first review the findings with you in simple, clear language. If the cause is a urinary tract infection, they will prescribe antibiotics and discuss ways to prevent future infections. If the issue is diabetes-related, they may work with your primary doctor or endocrinologist to manage blood sugar, since controlling diabetes can greatly reduce urination frequency. For men, an enlarged prostate, benign prostatic hyperplasia, is a common diagnosis. In this case, medications may be recommended to relax the muscles or shrink the prostate. In more advanced cases, minimally invasive procedures or surgery might be discussed. If an overactive bladder is diagnosed, treatment could include bladder training, lifestyle changes, or medications that calm bladder contractions. The urologist may also provide specific advice for diet and lifestyle, reducing caffeine, cutting back on evening fluids, losing weight, or doing pelvic floor exercises. In serious but less common cases, such as bladder cancer or structural problem surgeries or advanced therapies may be required. What matters most is that the plan is personalized. No two patients are the same, and the urologist's role is to design a treatment strategy that addresses not just the symptom of frequent urination, but also the underlying cause. This clarity often gives patients relief and hope, knowing they finally have a path forward. Frequent urination may feel like a small inconvenience, but it can be your body's way of signaling something much more important. From infections and diabetes to prostate conditions or bladder problems, the causes vary widely, and only a urologist can connect all the clues to find the true reason. The good news is that with proper diagnosis and treatment, most people see dramatic improvement. Sleep becomes more restful, energy returns, and confidence in daily life is restored. The key is not waiting or ignoring the signs. So if frequent urination is disrupting your nights, interfering with your work, or simply worrying you, take action. Make an appointment, ask your questions, and take control of your health. If this video helped ease your concerns, please give it a thumbs up, share it with someone who may need it, and subscribe for more trusted health insights. Your health is worth it.